Welcome everyone to today's Wearable Summit. So Shayla mentioned my name is Sandeep Patel. I'm the director of the Division Research Innovation Ventures Division at BARDA. And I have the distinct honor of introducing you and taking you into the rest of the meeting today. Before I start, I just wanted to make sure to thank again all of the participants and speakers and panelists that are joining today. And also our co-organizers, our friends at the Department of Defense, the Defense Threat Reduction Agency, the Defense Advanced Research Projects Agency, DARPA, DIU, Defense Innovation Unit, and our fellow HS colleagues at the National Institutes of Health. So why wearables? I think we're all familiar with the concept of a wearable. In fact, it's conveniently embedded in the name itself. But what does that really mean? I think, at least to me, health wearables provide an accessible platform, I think, that can peer into our bodies in a uniquely self-empowering way. There's an inherent sense of intimacy and agency associated with them. You know, the idea that no one is drawing your blood, no one is taking a vital, it's just you and your wearable is a really powerful image and a powerful kind of thought. And kind of looking forward into the future, I think one thing that's quite clear is that there's almost an inevitability to the development of wearable devices for health. But there's no inevitability in terms of like how and which kinds of devices are going to be developed and what are prioritized. And I think that's part of the discussion today is what I'm hoping to bring out is that kind of a conversation. But there's a few trends worth noting. So one is that we have a growing market. We have a set of very commercially successful platforms, and more importantly, associated with them, increased normalization and demand for these kinds of devices. So, for example, 1 in 5 adults has a fitness tracker. 85% of U.S. adults own a smartphone. Yes, it skews younger, urban, richer, but I think that is changing quite fast as time goes along. So that's one. So two. Sensors are getting more complex, smaller, cheaper, increasingly multiplex. In fact, that's a lot of where our efforts at BARDA are being placed is in developing new kinds of sensor capabilities. We're also better now at developing and building smart algorithms that can create unique insights from them. And I think four, most importantly, at least to me, is that we've uncovered, from the demand side, a huge amount of what I call latent demand. In other words, I think fundamentally, we all want to know about ourselves, who we are, how we're doing, and wearables have the potential to empower us in entirely new ways and to give us a new vocabulary on, for example, how sick we might be feeling. And I think those trends combined create kind of a unique moment right now in terms of the acceleration and development of these kinds of technologies. And they're already being used in wellness, rehabilitation, safety monitoring, assessment of treatment efficacy, even early detection of illness. They have the potential to care for a large number of patients with, for example, complex health conditions or disabilities, those with limited access to healthcare providers, and can also, and this is something of interest to us, to detect infection early, which is an issue that has come first, front and center during the pandemic. But I think, largely we're still at the early stages of its promise and potential. And I think part of what we want to discuss today is, how we want to step forward. Another issue that I think is important is wearables have the potential to connect, public health and healthcare. So, we think of these very distinct things where, you have the practice of medicine, the patient-provider kind of relationship, and then you have the public health interest. And wearables, have the potential to both empower an individual to provide information about themselves, but also in context with other information can provide unique public health insights that I think are extremely important. And I think, so here's where sort of the rubber meets the road. And I think this is why we're all here today. As we look forward, there's sort of what's technologically possible kind of part of the development. And then there's what do we need to develop to provide maximum value to people in public health piece of this, and what are the other considerations and perspectives that we need to come to bear. And so, today we have a lot of perspectives that we're going to bring forth. Patients, providers, payers, caregivers, data security experts, regulatory bodies, funders of R&D, both public and private, I think there's all of these voices, and we're here today to give voice to those perspectives, to listen to those perspectives, and hopefully by the end of the day, have a slightly clearer path on kind of the development than perhaps we did at the beginning of the day. Over the last several years, there's been a robust community that's been built among federal R&D agencies, many of whom you'll hear from today, that's come together exploring advancing the utility and effectiveness of health wearables. And we want to expand that conversation to include many other communities that are also having these conversations that are represented here today. So I'll start briefly by sharing my own perspective as a representative of BARDA and as the leader of the Drive division there. And so I like to think about this in two categories. So one is sensing and the other is treating. So let's just take sensing. So, how many of us have had the flu or another infection that initially, before any clinical symptoms showed up, had that feeling that something was wrong, but you couldn't really pin down what it was, whether you were imagining it or not, and why you were feeling that way in particular. And one thing that's extremely powerful and that we're looking at is, can wearables provide that early and actionable information to verify that feeling that something might be wrong before any symptoms might show up? And that's a really important time, both from an individual's perspective to get care early, but also from the public health perspective, for example, in the context of a pandemic. Wearables also can provide new tools to enhance, speed up recruitment and monitoring clinical trials. We're also interested in wearables from a treatment perspective. They can provide new platforms for controlled drug and vaccine delivery. And then there's also magic in the combination of the two applied to specific needs. You'll hear later today from Dana Lewis about her journey developing a closed loop insulin pump. And I think it's a great example of sort of the combination of the two as well. And then let me just end real quick by kind of sharing. So before I joined BARDA, I spent the last several years working in another part of HHS, working closely with people suffering from kidney failure who effectively are tethered to a machine for the rest of their lives, 4 hours a day, 3 days a week. And part of the quest that we were developing was to think about alternatives to dialysis. And one of the possibilities is a wearable dialysis machine, that, for example, could be tucked under a shirt and hidden and invisible. And the comment we got from just about every one of the hundreds of patients that we spoke with during that journey is that all they really wanted is to become untethered so that they could live, work, play just like anyone else. And I think that idea of becoming untethered really, really stuck with me. And to me, in a nutshell, that's the power and promise of wearables to help us untether, whether it's the doctor's office, the emergency room, or attached to large medical devices, or whatever the context is. I think that's sort of the power of it. So I will stop there. A couple quick housekeeping notes just on top of Shayla's. We want to hear from you, the attendees. That's the whole point. So please, I highly encourage you to submit questions to the Q&A function. For those of you in social media, we're using the hashtag wearables. And then I'd like to thank Dr. Shayla Selamovich and the Drive team for putting together the meeting today. And without further ado, I'm going to pass it over to my colleague, Dr. Wei-Xing Wang, who's going to talk about introduce our first session on the medical provider perspective on this. So enjoy the meeting, everyone. Take it away, Wei-Xing.